Hello, everybody. Thank you very much for your attention. And we've just been having, for those people who have not been on the call before now, we've been having a very lively conversation around the role of the fixed practices within any modality. And of course, homeopathy is so well represented in this community here today. So just like to welcome everybody. So I wonder if we could just go around and if you could just very briefly, introduce yourself, and then we can commence the topic of today. So perhaps we could start with you, Mansoor. I don't know where everybody is on everybody else's screen.
Right. Hello, everyone. I'm Dr. Mansoor Mirza from Mumbai, India. I am primarily a homeopathic physician. But during the journey of learning, I've done a lot of holistic healing courses. And I do realize that homeopathy is also holistic healing. So maybe you require some energies from all sides to really complete the healing. As I feel that any one therapy is incomplete, it requires, sometimes it requires multiple forces to set the healing right. And it's been a very interesting and challenging journey, but a lot of fun. And I hope to learn from everyone's experiences and share a bit of mine. Thank you.
Thank you, Mansoor.
Thank you.
Who'd like to go next?
Yeah, I am Dr. Meeta Nihlani. I'm from India, and I stay in a centrally located state of India. I've been practicing since 30 years, and I've learned a lot in these 30 years. I've grown up as a person, as a homeopath. And homeopathy has taught me so many things in my life. I have integrated many healing modalities in my practice. I even studied touch of matrix. And I've integrated many energy healing modalities in my practice, especially after sensation method. There were many portals to that zero state, what we understand is the true state of your being. So I also have an institute in Raipur. I've been teaching since 2007. So I have many, many, many young budding students with me who come and learn, and even they grow and evolve with us. So this is a journey of growing and evolving. And I love this platform because we come together and discuss things from all over the world. And it's thanks to Marianne and Sandra for bringing us here together. Yeah, so that's about me.
Thank you, Meeta. Rajeshwari, what maybe you could introduce yourself.
Yeah, I'm Dr. Rajeshwari. As I know that I've been attending this session since beginning. Dr. Mary has introduced us. I'm a homeopathic consultant. I was a professor in the Department of Anatomy, and I'm practicing since last 22 years. That's all.
Thank you. Paolo.
I am Paolo Campanella. I live in Varese, close to Milan, town close to Milan, in Italy. And I've been practicing homeopathy since 28 years. And I really love this, the journey into homeopathy, because it is the journey of a life, one's life. And above all, in my first years, I didn't find a correct method, practical method, theoretical method, yes, organon and Kant and so on, but not a practical one. I didn't, my teachers didn't explain me the correct method, but after a few years, I learned, I met Dr. Darius Knidi from Switzerland, just 100 kilometers from me. And from that on, I have been a student of him. And now I built my method, and I do believe that the method is very important, not in order to root one's feet into the basis of the homeopathic practice. And then we can spread all over and change and try and so on. But what in Europe, for example, we find this is not the rule. Many people go around with a lot of confusion without the important method to practice. And my practice did change a lot when so this is my key point I want to share with you today.
Oh, thank you. Okay, well, I'm Neil Dugan, and I'm not a homeopath. I'm a healer. I work in Perth and Western Australia. I have a client list all over the world. I've seen tens of thousands of clients, which for the kind of work that I do is actually quite a large client list. I have an active client list of approaching 1,000 at the moment. I am author of four books, and I'm just publishing another one at the moment. And it's about the decline of our society. And it's about, the title is, Are We on the Brink? And when I think about the topic for, for today's talk, it really is the question of, are we on the brink? We're looking at this post-COVID world, and there's been so much trauma for so many people in so many countries. And we get to ask the question, are we at the point where we're facing some kind of extinction event? Are we in something as dramatic as that? And my view personally is that there are two potentials for the extinction event. One of them is that we lose what it means to be humans. And I hear what Paolo's talking about there, and I'm sure everybody else as well, but it's about what it means to be human. And as a practitioner, how to connect into what it means to be human. And we definitely are staring down the barrel of a gun, and the gun is named, it's the motivation that is leading people to deny the opportunities for diversity. So I see that as being one potential extinction event that we're actually facing. And the second extinction event that we are facing at the moment is the potential for medical misadventure. And I'm really looking forward to hearing what you all have to say, because this issue around the post-COVID world, where we get almost a huge chunk of the population vaccinated, and we change the immune structures in people's bodies and all that type of thing. This is really changing how we are. And so I'd like to throw it open. And, whilst it's not exactly what, we said we were going to talk about, I feel as though, the opportunity, it was too good of an opportunity for me not to actually mention what I'm working with at the moment. So thank you for having me here. So I appreciate the opportunity of talking. So the topic of how, issues, and I'm happy for it to be as, detailed about homeopathy as you wish, but how do you each see this process that's coming, like in the next 6 months, how the health of people and the health of society, how the health of society is actually going to be supported?
I break the ice. Okay. Well, first thing that comes to my mind is that what I found is that each patient reacts in his personal way to this pandemic. It is a collective issue, but I mean in a psychological sense. There are many different ways. There are some conspirational people, for example, many sepia patients or lycopodium patients having had a very dictatorial mother or father, and now perceiving that the society or the governments are trying to conquer their freedom, and so they are struggling a lot. On the opposite side, there are mainstream people, very more yielding on this subject and so on. And in the middle, there are many different nuances, differences of gray color, okay, many differences. So I do believe that the most important thing we can do is to give the simillimum to the patient, because it clears the wrong perceiving, that means also a wrong reaction to life on a biological level, biochemical level, psychological, and so on. So I do believe that homeopathy can do a lot. Of course, it's not only this, but this is my contribution to the discussion.
Thank you.
Okay, so do you want me to go next? Okay, I'll say that, the post-COVID syndrome, we basically have two basic, divisions. One is the physical manifestations only, or the COVID and the post-COVID physical manifestation of the disease. And the second is the psychological or the mental impact of COVID-19. So as we all know, and we're all going through it, I think there's not a single person who's immune to this. We've all undergone a severe shock to our system in some way or the other, and it has changed the way we think, the way we connect to the world around us, the way we connect to ourselves. And it has led to a lot of positive lessons on one hand. At the same time, we are getting into a more also a negativity, because there's a lot of negativity all around us through the news channels, through doomsday, and the anxiety about the insecurity about life at the whole. When you feel that life is very secure, your finances and your position is going to take care of you, but now everything is so insecure, you wouldn't know when you're ill or when you're going to die or what is going to happen to the world the next day, and everything is changing so rapidly. At the same time, your perception of yourself vis-a-vis the world is keeping on changing very rapidly. And, new concepts of immunization and a battle with, yourself versus what you want yourself to be, and your plans not being met. And a lot of other, factors externally and internally are, shaking up our systems. For some of us who are probably more spiritual, they can probably take in the whole brunt of it and go ahead and evolve. But a large number of us, we have to deal with these, the whole mechanism being shaken up. And it leads to a lot of mental illnesses, or mental issues which we face, right from anxiety, depression, bipolar or mood disorders, personality disorders coming to the fore, and panic disorders. So, you see this manifesting at every level, and it's going to be much, much more as time goes by, as, people realize their sensitivities and expressions, etc. So I think, we are probably going to talk about all this. So, I think this is my mainstay of what I would like to express or share. So, part of that, yeah. Meeta, your voice. Meeta, your mic.
Microphone is off.
Yeah, so we in India, we are experiencing second wave of COVID-19. So it's been since last March. It's almost 14 months now, 15 months. So throughout my practice, what I've seen is initially we had physical manifestations of this. But, gradually we have all been swept by this panic wave. So it is, like we all are experiencing our different way of being in this world. So if we take it positively, there are many people who are taking this, positively. They are understanding why this is happening, the bigger picture of it. But those who are not able to see the bigger picture are being swept with this panic wave. So I'm getting many patients, who have, now we have two types of patients. One who have gone through this for COVID, most of them have experienced this COVID in their families and within themselves. So they are experiencing post-COVID symptoms, which are fatigue, and they are not able to sleep. They have those deep bony pains. There is, like no appetite, or still they are not having that sense of smell and taste. So it is one group of people who are experiencing physical remnants of the disease, which is easily being taken care with homeopathy. And the second set of people are, who have experienced their close people like going through this COVID. And in India, the way it has been, we didn't even have, at a point, we didn't have beds to be occupied, there was no oxygen. You have been seeing these hashtag India gasping. So this phase has really put us in serious trauma, or going through, seeing our near and dear ones, gasping for breath. and seeing all these posts on social medias, these funeral pyres burning, and there is, long queue. So now this has somehow made us realize the sanctity of life, how precious life is, and how grateful we should be for each and every day, and how we have to make the best of whatever has been given to us. So we all are facing different phases of all this, from our own views, perspectives. So now it's like, there is a much scope for health coaches and, motivational speakers who are coming up, and, they are showing us a way how to look at this from a perspective which will help us to go beyond. So, and India being a very spiritual country, we are being taught, like, when you can't go out, just go within. And so this is a time when we are getting these times, we were racing against time till now. We were just rushing because someone else besides us was rushing. We were wanting things just because someone else was having some things which we didn't have. It was getting so materialistic. So now this is a time to go within and, think that, was this really ever required? This kind of a rat race or this type of a rush. So it's a time to just go within and experience our beings in a different way, which is more than just being material. We can just sit back and enjoy lives with what we have, especially the family bonds in India now. Like we are, many of us initially were joint families. Now we are going to in an era of nuclear families. So again, in families also, people were just rushing out. But now this is a time to just come together and enjoy those bonds without, the external flavor given to it. And, many of us were just being carried away by the digital media. So again, this is a time to really think that, does that even make sense? So it is, like we are in the midst of chaos, but this is again going to take us towards a coherence. So it is from the chaos to coherence. It's a journey from there. But we just need the right perspective so that, we can rethink and we can restructure our life. So this is a turmoil, and this is a scenario we have been seeing in this 1 year.
Rajeshwari, what's your opinion here?
Yes, beautiful words. I agree to Dr. Meeta, whatever she said. Such beautiful description of how we are going through this big change from outwards to within. That's the right perspective, actually. People have to now go through that spiritual change and go within. For India, you can say the situation is like going from the frying pan to fire. Actually, situation was being in control in the last few months, but later suddenly the second wave started, and then we have so many variants, and then lots of diseases like mucormycosis has come, and then you have the post-COVID anxiety, and so many fatigue is there, and so many complications of the treatments which are given, like glucocorticoids are being given, and so many drug-induced diseases. So basically, it's a maze of diseases which are following the post-COVID. And as Dr. Meeta said, there are two groups of people. One who have already suffered from COVID and have survived that. And after that, they are getting some kind of complications or symptoms after the suffering. And then there is another group of people who have not still acquired the COVID, but they are in a psychosomatic type of condition where they are having that fear and anxiety, insomnia, and all those conditions. And then these are the people actually who are about to enter that COVID phase because they are reducing their immunity because of all those psychological symptoms. So these people have to take care, first of all, so that they don't reduce their immunity thinking and having that fear or anxieties and all that. So while as a homeopath, when we are treating the patients, we see both the conditions, post-COVID symptoms, and the people who are not acquired the COVID, but still they are having the symptoms and they are fearful whether they are having the COVID or they are about to go for the positive results. So these two kinds of people we are seeing. That's it.
Well, look, I have a completely different perspective here in Australia, and that is because we haven't had an open outbreak. So we've had COVID cases here, but they've all been people who have come from another country. They're in the quarantine. They become sick in the quarantine. Sometimes the cases leak out of the hotel where they have them in the quarantine, but they're picked up very quickly by the medical system here, and they have all the contact tracing and that type of thing going on. So we don't, here in Australia, we don't have a range of people who have suffered from the infection. So we just don't have them. And yet we have a post-COVID syndrome of extraordinary extent, you know, like the actual trauma, the psychological trauma to people, and the psychosomatic type of disease expression is just off the chart. It's absolutely off the chart. So things that, you know, people would read about on social media, and they would look at symptoms, for example, and they're presenting with all of these symptoms without the COVID. so they're rocking up with the disease, but without actually having the virus. And seeing this over and over and over again. And you know, colleagues everywhere in Australia are commenting on this. So it's very interesting to hear what you're you're talking about from the Indian perspective. And I know in Italy you had a lot of open outbreak as well, Paolo. So you know, Italy was a country that had a lot of infection in the community. So you know, you will have seen some of those similar types of things going on, and you know, this the post-infection symptoms and that type of thing, which are reasonably, well, anyway, I won't go down that track, but whenever you get an infection, you always have something come on from it, of course. But it's just, I just want to reflect that even in a country like Australia, which has not had open infections at all, we still have suffered all of the same psychosomatic and psychiatric and psychological issues that you're talking about. There's no relief from it, no difference at all. Yeah. So they have all the borders closed, for example. For over a year now, I'm not allowed to leave the country. So it's not possible for me to leave the country. And the reason for that is that if I go somewhere, I won't be allowed to come back again. And so they shut the borders. This type of thing, the psychological effect of it is extraordinary. And I hear, what you're saying, that it's a wonderful opportunity to go within, but that's not what the average person is experiencing.
Yes,
it's okay for us.
In Italy, the pandemic began in Italy. Practically speaking, of course, it was in Wuhan in China, but in Western world and the rest of the world, it was in Italy and very close to my town. I mean, not of Italy, not part of Italy. And I don't know if it is off topic. I don't know how is this discussion conceived, because I had prepared brief presentation of cases, but I don't know, I have not talked to Marianne. Maybe this is not the case to share with you this. But anyway, this patient of mine, I can share you just this information, 50 years old woman, got an infection of COVID. He was just 25 kilometers from Alzano Lombardo. That is the real place where the epicenter of the pandemic of the world. You can imagine a new pandemic, and nobody knows what is, and you can only listen. You are lying on bed. You cannot rise up to go to the door where the other relatives brought you the food to eat. You have just to walk like that, like a child, because you have not strength enough to stand up and to work standing. And then otherwise total prostration, and you can only hear bell ringing down in Europe. This kind of sound is associated with funerals. You can only listen to this kind of bells, to the sound of bells, and then you can only see the ambulance sounds. no noises at all, because in the first wave, we were all closed totally. Not like in the second wave. For us, it was not like that. But in the first one, it was like a dystopic movie. I don't know. And 3 neighbors of this patient died just in the same building. You can imagine such a trauma, a psychological trauma. But anyway, this patient was cured by the remedy connected to the present symptoms she had, and it was phosphorus. And she got a wonderful results, as you all have results in India. And so and the other case is a long COVID patient instead, cured with lycopodium XM for COVID. And then in waves, he developed symptoms, and again I treated, and then everything in some months went away. But this is wonderful. We as a homeopath, in different ways, with our different methods, can do wonders with homeopathy. I have been 3 times in your country, in India. I love India for many reasons, and also for homeopathic reasons, because I've been in Niagara to the clinic of Dr. Alok Parekh. I don't know if you know him. And I've seen this huge amount of people you see every day, 100 or 20 people per day. It's incredible, no? It is wonderful. It is the other face of homeopathy, because we in the Western world have less people, we have much time, we can do a different kind of work. So I just love India and the Indian homeopaths. That's it.
Yeah, even we had this kind of a scenario, there was no voices, normally Indian roads are very, they have lots of commotion over here, lots of chaos, commotions, traffic. But this was a time when there was no traffic on the roads. And even I got a case in which that lady said that only the siren of the ambulance was there throughout the day. And she used to feel these palpitations and panic. She said even just when she heard that sound of the ambulance, the siren of the ambulance, she felt who might be traveling in that. What will happen to the family members? Is he a father to somebody? Is she a mother to somebody? How will their kids manage? What will happen to them? They will not be able to, we have a ritual of, like sending the dead body to there is a ritual, around hundreds of people, they come to visit the body for the last goodbye. So, she kept on thinking of all these, what will happen? There'll be no rituals, there'll be no final goodbye. And she had these palpitations. So as doctor, he said that he had given phosphorus. I gave pulsatilla in this case, because she said everything just came to me. Everything just came to me and start thinking of the panic. And it was a panic as if actually I was feeling what the family members were feeling. So just few doses of pulsatilla, although the potency had to be raised till 10 m, she was better. And after that, all her family members suffered from COVID. So she said that in spite of COVID in my family, she was able to render her responsibilities to the family members. She could take care of them. But she said, just picking up the phone also, it gave her jitters initially, because it will be some relative from her native town who had expired, She said she was getting all these news. But after that, after the doses, she said, I was able to be into myself and accept that, this is happening. And she could take care of everyone in her home, in her family. So this is how homeopathy was helping, like just a siren. Even now, after a year, she has texted. In the second wave, the things are pretty bad over here in my town as compared to the first wave. So she said, Ki, thanks so much, ma'am, that I'm able to hear those sounds and I'm not into my state of panic.
So we can say that this is how homeopathy can help us or help our patients to go within, inwards. So it will help them to go inwards and maintain their or stabilize their mindsets.
Yeah. So that inner strength, we can get from...
You can get it. So practically it is possible if people accept and take homeopathy at a time when they are already getting those psychotic symptoms.
Right.
They accept it, then their mental state will also become that way. And in that way, they will gradually increase their immunity and go on their routine course. That's
right. And also what I'm seeing is my old patients who, who are suffering from OCD, anxieties, and especially my OCD patients. Now they are being triggered. Even if they don't suffer from COVID, their OCD is triggered. So they are washing their hands, they are sanitizing, they are washing their clothes, So they are feeling that panic. So those who are, better off with the medicines, now we are seeing that they are coming back again with the same intensity. Even my bipolar patients who had stabilized their, moods were stabilized. But now they are coming back. So, like they were out of these treatments since 2 years. But now they are coming back. Although by giving the same doses in the higher potencies, they are getting settled. But, that diaspora of mental health is again affected.
I wonder if you could just speak about, like this changing incidence, if you like, in the mental health. And as you're talking about there, Meeta, you're saying that these were patients with a pre-existing condition, but it's triggered off again or deepened in some way. I've found like a massive explosion in my autism patients. I do a lot of work with autism patients, the whole spectrum, and there's been an explosion, particularly of adult onset. So, where the symptoms had actually been reasonably managed, coming through childhood and early adulthood. And as adults, like 50, 60-year-olds, they're beginning to show like really full expression of these autistic symptoms. Also ADD and ADHD as well. So I'm just very interested to hear, from you all, just actually what your experience is. What are you seeing? Is this just in Australia or is it elsewhere?
No, it's here also because, these autistic people, they are not able to go for their therapies also. The speech therapies has been stopped. The therapies they were taking for, aiding them, that all is stopped. So they are into the homes and there is practically no interaction with the other children, which they were gradually starting to be comfortable with the social interaction and all. So these children, again, they are pushed to be in their own homes. And the parents, again, they don't know how to handle them because parents are also going through their own stresses, the financial stresses, and taking care of the children throughout the day, or they are managing work from home. So managing these children has been very difficult. So there is a trigger in these such patients also. Yeah, I had a patient who is having epilepsy associated with autism. Means even she's back to square. Whatever work was done in 1.5 years, again, she didn't suffer from epilepsy during that 1.5 years. Again, it has triggered. So maybe the anxieties of they are picking, because these autistic children, they are very sensitive. So they are picking up the sensitivity from around also. And their parents also. So they are getting triggered. That is what I have observed here also.
How about in Italy? What are you finding in Italy, Paolo?
Right.
Autistic child.
Well, the psychological stuff, like these things like ADD, ADHD, autism, and so on.
This kind of conditions are growing and growing year after year. They are increasing and increasing more and more. And I really do not know why. I don't think it is just only because of the more key diagnosis tools. I don't think it's that. I think there is also an epidemic of this condition. There are different, a wide range, you know, between autism, very severe autism, also autism, a patient of mine with autism and convulsions and the psychosis also, very violent. On the other side, you have Asperger, very brilliant, very genial children. So I think it is a challenge for the homeopath, but I do believe that we can do something with that. And so I do believe that homeopathy has a lot of arrows to her bows, to its bow. Okay, this is what I think.
Yeah, fair enough. What are you finding, Mansoor? What are you finding?
I'd also find that, you know, see this whole thing of social distancing. So it's almost akin to an autistic state for, you know, the whole world as such. You cannot connect. You find the connection between the people you were connecting to so easily and so limitlessly before. It's all shut down. The avenues of connection, of meeting people is all shut down. You are physically limited and mentally you are more active all the time. You know, the physical barriers are there. You can't go beyond this. There are lockdowns. You cannot connect. And so, you know, when you're in one particular place like a caged animal, you know, you completely start also finding a lot of conflicts within that space, your family, your close family, knit family in that space. But you cannot connect to the wider society, that is your friends around you and people who you work with, you know, personally. Taking the energies are different, much different now. So it's like from a state of abundance, you feel like, you know, there's a state of scarcity thrust upon you. That is, you know, you are now limited. You have become imprisoned between, you know, so that you cannot connect, you cannot merge, you cannot go out in the environment. So I know of a lot of people who have not even stepped out of their home because of all these lockdowns. You know, they have some open air space around them, but they always feel there is an infection in the air. And if we go out, we'll be prone to this. So then it brings up a big panic, a lot of anxiety, insecurity about the future. So it's like, you know, we are almost being pushed into a corner, and we have to really take a lot of safeguards to see that we are sane in spite of all this. And the world, the media, everything is just pushing us into this deep fracture. Like there are no vaccines available in India. And there is a lot of, you know, the beds were not available for some time. And, you know, again, as Meeta has rightly said, that, you know, the funeral, which is a very important ritual for all, you know, for India, you know, at all communities, you know, the respect given to the dead and, you know, the sanctity, it is all lost. You know, it's just like a routine activity, which is, you know, not complete. There's no closure even in death, you know, for the family. So it's, this whole world is actually, we're really turning autistic. I don't know how, but we really need to continue the communication lines, whether it's electronically or through telephone, or, you know, even coming out and talking and, you know, keeping those connections alive, keeping the energy alive, because it's going to be a little difficult when we really come out to the external world, and, you know, the energies are going to again affect us again. So that all those memories which are very hazy will have to be reconnected again, because as I said, I'm speaking to you, the whole world around me, but, you know, that something is missing. Something, the live energy of the audience is missing, but we are getting used to that. This is maybe this way forward for, I don't know how many years, more years, or maybe a more easier way, but not a very effective way, nevertheless. So, you know, when you go to a webinar, you get that information, but when you see the speaker or speakers or this audience in a live audience, it's completely different experience. When you see a patient, so many patients, they want to come to me. I don't refuse them, because I really love to see my patients. I know that there is this whole distancing and stuff. I try to maintain it, but, you know, online and offline, big difference. But we have to work within our limits and whatever is, you know, so-called safe and beneficial for society, not only for us. So a lot of changes here.
Thank you, Mansoor. We actually have a question coming in on the chat, and it's to you, homeopaths. Which remedies have you used the most in for tiredness, for the post-COVID tiredness?
Post-COVID tiredness, number one remedies, which are coming up first is the constitutional. If I know the remedy, constitutional remedy, which has worked in the past, again, that is helping them to come back to the, to the grounds. And if there are some other remedies, recently I'm using nosodes also. Tuberculinum is the first remedy which I'm giving, because I gave that as a preventive also before this broke in. So tuberculinum AVR also 30 potency, it's helping. And one more nosode which I was using and recently read that, somebody else is also using, that is hyposinium.
What?
So hyposinium. The nosodes are helping. And if there are bony pains, breathlessness, recently I had a patient who just responded yesterday. She had this cough, the cough was not going. In spite the pneumonia was cleared, the lungs were clear, but she had this deep gasping and breath. So that was better by Merck iode, which was her constitutional remedy. So the constitutional remedies are helping, the nosodes are helping. And if there are deep fatigue, bony pains, then Eupatorium perfoliatum is also helping them. So that is, the one aspect is a symptomatic and other is the constitutional. So I'm taking both hand in hand, lower potency of the physical symptoms and the higher of the constitutional. I'm taking both in hand. So the patients are coming up very easily.
I had a patient of, she was having already diabetes, and apart from the post-COVID, she was having extreme weakness and fatigue, and then insomnia, was not able to sleep well, and then brain fat. She was forgetting things too. At that time, after taking the case, I found phosphoric acid very useful, and within 3-4 days, she recovered very well, and she was absolutely feeling fine within 3 days. All her exhaustion, weakness was all reduced.
Yeah, even I gave acid first to one of my patients. She also responded very well.
Apart from that, for the vaccination also, there were few patients, of course, from my relatives only. So after vaccination, one of my relative has suffered from severe abdominal pain and headache. So I gave Tuja 200 and Magfos. And within 6 hours, the abdominal pain reduced and the headache also reduced. He was feeling slightly feverish also, and that also reduced. And lots of anxiety was there, and not able to sleep because of that pain. Was just holding the abdomen and sitting like this, bending, and all that reduced. And absolutely, he thanked me for that. So that was one case. Another case also, I gave Tuja only 200 as a specific. I gave it because immediately I was also not understanding, because there were so many symptoms, and it was immediately I had to give something. I gave Tuja 200, and after that, along with Tuja, after that I gave Gelsemium, and these two also responded. Gelsemium was his constitutional, later on found, and gave Gelsemium after that. So that weakness and the symptoms of the post-vaccination, fever and pain, headache, joint pains, everything he got. So all that reduced after that. So these were two post-vaccination effects which were relieved by homeopathy.
Perfect. Well, I'm sure that's useful for the listener. I'm interested in what you're talking about there, this linkage between the pain and the tiredness and that type of thing. And I'm just wondering, you're also talking about the preconditions. So like you go back a year and a half ago or whatever. What about your patients who have fibromyalgia, for example? So that type of chronic fatigue syndrome, fibromyalgia and so on. What have you been finding with them in relationship to this virus or the vaccines for that matter?
Yeah, after vaccination now, even though people are not still sure about the vaccination effects, There are people who, even though after taking vaccination, have died, but they are just relating it with their comorbidities, that people having some other diseases, existing diseases with, along with the post-COVID symptoms. So still there, people are not sure whether it is because of vaccination or because of the comorbidities. But as a homeopath, we can say that even though government has given it as a mandatory for people, everybody, previously it was above 45 years, everybody has to take the vaccination. And of now it's above 18, everybody is being given the vaccination. So what I want to say is that even though they are taking the vaccination, it's better that they take homeopathic medicines to reduce the side effects of the vaccination. So even if they are having any comorbidities, if they are having some blood pressure, hypertension, they are having diabetes, uncontrolled diabetes, all these can lead to some complications. So better to take homeopathy along with that vaccination or after taking the vaccination. So that would be better solution, because we can't say that don't take vaccination. So that is the condition everywhere, I think. So it's a better solution that we give homeopathy along with the vaccination.
Yeah.
Yes, I do. I have many patients asking me something to give as a prevention of vaccination effects, but I do prefer to give something after, because the vital force, I mean, the body and the mind express themselves through a code made of symptoms. And so the symptoms are characteristic of the remedy to which the person is resonant and also oversensitive or allergic. So we give the remedy and we match the situation and we apply the law similar, but we have to deal with the correct remedy after having read the symptomatology of the patient. And I also had Gelsemium cases cured by homeopathy after vaccination, and also phosphorus. I had, for example, sulfur. But I think that the magic of homeopathy relies on its accuracy. It's like, it's very, very, very accurate. And so you can give the exact remedy matching the needed by the patient, because it is the patient itself that tells you. And it is wonderful. And I had a patient of mine, I just cited it, a Lycopodium patient as a constitution. And he presented with the COVID symptoms. It was in the first Italian wave in March 2020. And I collected the symptoms, acute symptoms, and they were Lycopodium symptoms. I gave a Lycopodium XM. After 1 week, he felt much better. But after that, he produced phosphorus symptoms. That was the second remedy in repertorization. That means very similar to Lycopodium, but a bit less. And I gave phosphorus, and then again phosphorus. He was better, but again there was something remaining. And the symptom was he experienced pain, of course, respiration difficult when ascending and when exertion, and palpitation, and many others. But above all, a strange symptom, a striking one, he felt, experienced the pain in his chest and above his sternum when raising the hand, the arms, or lifting something. And at the time I gave Kali Carbonicum, and everything just like a switch, everything changed. And it is wonderful. It was a zigzag cure. Maybe Kali Carbo was a real similimo, I don't mind. I'm humble. But anyway, what I mean is that homeopathy is a very, very, very efficacious therapy for patients. after COVID, in long COVID patient, and after vaccination. Because we have personal remedies instead of standard remedies, medicines.
Yes, so in India, we found that in the second wave, we are getting many cases of mucormycosis. Around 9,000 cases were found of mucormycosis, black fungus, it is commonly called here. And then we have found that there are a combination of these funguses like yellow fungus, black fungus, white fungus combined together in one of the hospital in North India. We had this one case. So this mucormycosis is more common, has become more common here in India. I don't know about your countries, whether it's there. Now it has been attributed to the lots of glucocorticoids which are being given as in the COVID situation when people are being admitted to the hospitals, and because of the drugs which have been given, and the people who are already having diabetes, uncontrolled diabetes, as a result, all these steroids are making the immunity lesser and lesser, and the people are getting the opportunistic infections. And amongst them, one is the mucormycosis. Apart from that, mucormycosis, the pediatric cases are also increasing. It's called multi-system inflammatory syndrome in children. So pediatric cases are also increasing a lot in India. So that's one of the concerns here.
Yeah, the difference between the first wave and second wave is that the first wave affected senior citizens, and this wave is affecting more people between 30 and 40. And what they are predicting that the third wave, which we are expecting around in September, October, will be affecting the children, the lower age. And that's what we are scared of again. Because first time we did not heed to the warnings, like we were out of that first wave and we all were so happy. We were going towards that normal life, and in the process of doing that, we just went into the second wave. So I think this time we'll have to be more careful.
Yeah, more careful.
These COVID cases, pediatric COVID cases, serious illnesses or simply mild fever and mild symptoms? In your country, I mean.
Yes, pardon. Can you repeat?
If I well understood you, you said that you told that there are COVID cases increased in children, isn't it?
Yeah, yeah.
And
no, in my area, I have seen not it in children, not yet, but the age group is 30 to 40. This time, maximum people who succumb to COVID, they were between 30 to 40. And next wave, what we will be expecting is pediatric. So in my area, I'm not seeing any pediatric case succumbing to COVID.
With mild symptoms or with severe symptoms?
Serious symptoms. The oxygen level immediately went down and they couldn't survive because there was no hospitals and no oxygen was available to them on time.
Also in 30, 40 years old. And are these people, these patients, suppressed patients with immunodeficiency? What I mean is, I don't know. Yes, it's not your experience.
Yeah, this variant was not with comorbidities. The first variant in last year, it was that it affected old people, the senior citizens with comorbidity. But this time it was people from 30 to 40, absolutely healthy.
Absolutely healthy.
Yeah, this time it was more scarier, because last time we could somehow accept people with diabetes and hypertension and other comorbidities, chronic kidney diseases were succumbing. So last time somehow we were able to accept that, but this time it was very scary because 30, 35 people and just neighborhood children we have seen them, passing on their bikes and all recently, and just suddenly we come to know they are no more. So this time it was more scarier, and that's why, most of us did not step out from our houses for at least 1.5 months. We didn't have groceries, we didn't have vegetables, all the grocery shops, the vegetables, everything was closed down this time. So, and again, they are saying that we can expect, third wave, and that will be affecting the smaller children. So that is more scarier for us this time. We need to work more on a mental and physical health. And I'll suggest people who are on homeopathy, they take more of their constitutional doses, because I've seen even my patients who are on their constitutional remedies, even if they suffered from COVID, they were out of it very soon.
Yeah.
Just few constitutional doses, help them. Like I had a panic call from my patient who was having this pneumonia and opaque glass opacities. And I told her, because I won't be able to see her, we were locked down in our homes and we were not allowed to move outside. I told her to go for allopathy. She said, no, ma'am, I know exactly the same sensation which I used to get, it's the same. So I know your remedy will work. So my patient, not knowing about what sensation is, what she says, I'm feeling the same heat and I know it's only your remedy which will work. So again, I told her, take your antibiotics along with my medicine, because once the oxygen drops, I won't be there around. We won't have hospitals. We won't have oxygen. So just be careful to be in touch with your allopath also. But the moment she took her remedy, which was lac caninum, and I think 3-4 doses, she called up that she's feeling much better. Although she had cough, for which I gave her phosphorus again. So
how is the homeoprophylaxis in India? I've read about, for example, Gujarat, or maybe also Kerala, where homeoprophylaxis were introduced. But I don't know, I have not a wide idea of the landscape of the homeoprophylaxis, because we have a huge numbers of people compared with us in the Western world. So it would be very interesting to know that more or less the numbers and the results. I don't know if you have any data about that.
Yeah, see, keeping the data was very difficult. And that's why I didn't give these remedies as a prophylaxis to all the patients. Only the patients who were registered with me and whom I could, follow up. Like I did not give to people whom I was not able to follow up, just because of these. But there were many people, these WhatsApp messages were circulating and people have taken them on their own also. But talking about data, I don't think we'll be able to come to statistics so easily. Again, it needs a lot of work to be done. There were many NGOs and social organizations who were giving these medicines as prophylaxis, but I don't think anybody of them was able to keep up the data. But whomever I gave to my patients, but I didn't give a common remedy. Most of the time I gave them their constitutional remedies only, and a no-so besides that. So that has worked in my patients. But I did not give any prophylaxis to patients who are not registered with me, and neither the COVID treatment to patients who are not registered with me, because I didn't understand their constitutional reactions. So that was risky.
It's a very interesting question, Paolo, that you're asking. And of course, given the urgency of the situation and the complications in India, it was never able to be followed up. I can understand why. It's just too complicated and too much chaos going on. And as you say, people doing these things via WhatsApp messages and all of that type of thing. There's just no reliability about the data, which is a tragedy in a way. You might find this strange, but we've had an upswing of people with low oxygen, particularly affecting their brains. No COVID, so like there's no COVID in the country, but they're having the same symptoms. Same thing with sugar metabolism issues. So particularly lack of sugar actually getting into the brain. So like they're getting a lot of brain fog and that type of thing relating to low sugar levels actually meeting the brain tissue. So they have sufficient sugar in the blood, but the blood's not, the brain's not allowing the sugar to actually come into the brain. And, this is curious, like it's not something that I've ever seen before. I've not seen this sort of the scope, the number of patients that are actually expressing this. And this is all without any COVID. So the actual worldwide psychological effect of these things and the way in which, you know, from my perspective, you know, I'm interested in these subtle means of communication of these things. And it appears to me, you know, without a doubt, that you don't need to actually have the virus in operation for a country like Australia to start showing up the same kind of symptoms. That's absolutely the case. And it's not just that they're talking about it either. It's out, you know, it's out and amongst us. I don't know what you do about that. As a homeopath, I wouldn't know how to actually approach it. But anyway, curious. So where do we go? Where do we go? We're just going to keep going with the constitutional approach. Seems to be what you're talking about, Meeta, as being the, you know, the fundamental thing is just to support people. And as an outsider, I'm not a homeopath, but as an outsider, I understand this notion of the constitutional remedies is to actually look after the, you know, the natural health of the individual. So, you know, that's fundamentally where you're working from. And that seems to be an extremely logical approach. Is there anything else that, you know, that you would all like to add to that as being an approach going forward, or you just have to take things one by one, person by person?
Yeah, let me go. So I would say three things. One thing is following homeopathy. We give the homeopathy on the basis of constitution, and also following certain lifestyle, like following the diet, proper diet, exercises, to maintain your general health. You know, people, because of this lockdown, are staying at home, restricted between the four walls, so unable to do exercise and following a very different routine, daily routine. You know, not sleeping on the time, not eating at one time. So let them follow. Everybody should follow the right, proper lifestyle as they were in the normal period, normal before the pre-COVID stage. So following that is very important. Like Dr. Hahnemann has said in his diet and regime, how we have to follow our lifestyle. That is the very important thing, so that it maintains our immunity. That is one thing. And second thing is any simple psychosomatic conditions, it's important to take homeopathy. In India, we have the Ayush Ministry. They have given us certain guidelines also for homeopaths as well as for the people to take certain homeopathic medicines. Those are not, they are not constitutional, you can say, but as a, you can say the generic or specific medicines. So they have given in their guidelines. So we sometimes we follow that also, as well as the constitutional symptoms to those people who come to us. So that's one solution for this time. Another thing is people who are hospitalized, especially those who are hospitalized for COVID and later after getting discharged, it is noticed that these people go into complications after being discharged. You know, after 15 days, it's seen that people have died after getting discharged. And why these things happen, we as homeopaths, we know that it can be because of the certain overdoses of drugs and all, toxicity of the drugs and all. And another symptom like fear and anxiety too, people can succumb. And all these things have to be noted, and according to that, one can give the homeopathic medicines post-COVID too. So that's what I wanted to say regarding this.
Right.
Yeah.
So what I wanted, yeah.
Sorry, go Meeta, please.
Right. So what I wanted to stress on that homeopathic remedies were, were too good, were helping too much to come out of this post-COVID syndrome, the breathlessness, the remaining breathlessness, the fatigue, the body ache, the deep pains, there were many common homeopathic remedies and which, which were easily helping the patients to come out of that post-COVID syndrome in 48 hours. For us also, it was very surprising, and it was fascinating to see that so easily common homeopathic remedies were helping them to come out. It was a common symptom, the remedies which we studied in first year, and they were helping. It was not that we had to do that, superhuman work. It was very few remedies and very simple remedies which we use normally in influenza. The post-influenzal remedies, they were helping the patients to come out. Like just day before yesterday, I had a patient of post-COVID, and today just now he messaged, while in this, that he's feeling much better. So he was already a patient he had these OCD traits, so COVID is doing nothing rather than expressing what they were suffering, and it is just bringing to the surface.
Yes, correct.
Right. It is not that, it is because of COVID. These people are having these traits of OCD, anxiety. So it's, this pandemic is bringing everything which was under the carpet. As a humanity, as a race also, we have put so many things under the carpet. We were just rushing off. So I think if we see this bigger picture also, we have to just go within us, as homeopaths, as persons, as individuals, as races, as countries. We have to just see what it was that we were not able to see, the capital SC. We have to see that. We have to see what, as a race, we were not wanting to see. And that is all the under the carpet things are just surfacing. And we have to just have a broader perspective to look at it, to be able to understand what mistakes we were doing as individuals and as a human race also. So this is how, when we see this thing in totality, we homeopaths like to see things in totality. So it's a smaller totality. It's at the particular level of COVID and the grand generalization. So we have to again see this disease, this pandemic, with a broader vision and see what needs to be changed rather than putting everything under the carpet.
Yes, I totally agree. We know that homeopathy is founded on laws similars. And we know that Patanjali, the founder of yoga, wise founder of yoga, used to say, wrote that mind is like a diamond. And that is that it assumes the color of the object to which it poses, okay? He's here and here and here. And so it means that the purer is the diamond, and it is also the mind, and the more it is able to reflect what it is, the present moment. And the impurities are the ego that we all have, more or less. And the more we have, the more we have we need a constitutional remedy to clean them off. And what I mean is that the real law, the first simile, simile is the present instant. The actual moment is the first curative agent, because in meditation, in all kinds of spiritualities, it is the present moment we have to deal with, and to disappear in the present moment, and to be the best, to resonate to what it is the best thing we can do. And this is also the first similar remedy we have. And so I do believe that this pandemics is like that. And the best we can do is to disappear in front, like Patanjali said or wrote, to disappear and to stay to what it is, instead of to try to resist to it. Of course, we have to fight, but this is another question. This is another level. On the other level, an healthy person should stay with the present moment. For example, there is a lockdown. Okay, let's do something we have never been able to do because we had no time. Let's understand that we can. That is to be grateful to our relatives and so on. I do remember the end of the first lockdown in Varese, in my town. And I was so happy to see the artisans, the shopkeepers repairing or painting their shops. Also, some of them I didn't know. I don't deal with them, but anyway, I say I'm so grateful that you are part of my community. I don't know if you have had this kind of such an experience. So I do believe that we have to learn to stay with the present instant. And this is why homeopathy is so a wonderful medicine.
Amazing.
Yes.
I have one perspective that whenever I see the people, patients coming, I group them into two kinds. Like one having the miasmatic approach, who are having comorbidities, and the other group who are healthy but still having the COVID symptoms or have been positive in the post-COVID symptoms. So these two categorizations help us to diagnose the condition properly and give them the proper miasmatic remedy and the constitutional medicine. This helps the patients become better very faster. So I think this approach is helping me.
Can you please repeat it? I'm not understood.
I categorize the patients into two. One kind who are already healthy and are going to suffer as a preventive, we can say going to suffer, or those people who are having milder symptoms. So this kind of one categorization I do, and then miasmatic approach helps here. And second categorization is those people who already have comorbidities. At that time also miasmatic approach helps, and giving them the miasmatic and constitutional medicine by these two categorizations help to achieve the cure faster, or helps the people to relieve of their symptoms. So wonderful. That's one approach.
I'm just weary of the time here, folks. I wonder if we could just go around and if there's any sort of parting suggestions that you'd like to make to listeners. I know that these calls are well listened to by people all around the world over a period of a week or so. So what would your parting suggestions? So Rajeshwari, you've just been giving us some parting suggestions there almost, but if you've got anything else that you'd just like to add at this point.
So at one level, we are using a homeopathic remedy to find a balance, and harmonize or create that homeostatic state once again, and putting everything back into balance for the patient. But at the other level, it also stimulates the patient to make an effort. So we have to, as a patient, the patients make an effort to make their external and internal life also balanced. So they try to do certain things which they've not been doing enough, or in order to that they're doing excess of a particular activity, or they are not doing something. So try to put that all into the right perspective and balance it out. So once that is done with their efforts, also through the effort of the energy of the medicine, so then healing is almost virtually complete, and they're living in the present moment, So that's how healing is, from within out and from outwards within. So it's complete balance and, being okay at the moment.
Yeah, and my message will be, not to ignore any symptom which they are experiencing, because what I noticed in this second wave, that whoever passed out, whoever succumbed, most of them, they were the people who initially ignored the symptoms. Like be it a small cough or a sneeze or even a temperature of 99, many of them were suffering. This time the fever was not too high in most of the cases. So it was around 99 to 100 also. But on the 6th, 7th day, the oxygen started dropping down. So what I'll suggest is, not to ignore any small trivial symptoms in these times of pandemics. So it is more of self-care is to be needed, and more awareness is to be needed, every symptom has to be taken care of. You don't have to wait for few days, 1, 2, whatever system you can avail, whatever system on which you have faith, just take the medicines, and you try to work on your immunity level. First and foremost, you should not be having those symptoms. Your immunity level has to be upgraded. And for that, mental and physical, both well-being have to be taken care of. It is initially in India, we were taking all those, herbal teas and all to have that physical immunity. But physical and mental immunity at the same time is important. So for physical immunity, your diet, exercise, sleep, happy feelings are important. For the mental well-being, don't be overly exposed to media. Just be aware of whatever is going on, but don't be overly exposed to media. Don't keep on chewing those media things. Even that is your mental diet. So you have to be careful about your physical and mental diet, what you're taking, what are your thoughts, what are your emotions. So detoxification has to happen at both the levels, mind and physical. Because if you're mentally down, your immune system will go down. So first thing, you don't have to be there, you have to physically and mentally strong to face this pandemic. As a humanity, as a race, we have to face this positively. And second, even if you get any symptom, don't ignore. It may be very trivial, but you have to be very aware. You have to start asking for treatment within 48 hours. Because most of the people who I have saw succumbing were those who ignored their fever for 6th or 7th day, and then their oxygen started crashing. So that is a message which I would love to extend.
Thank you. Yeah. Paolo, what's your parting information for us?
Oh, my colleagues have said a lot of what I totally agree with them. I only want to stress one point, that healthy condition is silence, is zero, is the basic line. And of course, the problem, the issue we also have, we all have a constitution, and so we have I can tell you, a freeze frame. We are reacting to in a fixed way to something, to menstruations or to cold or to warm. We have some kind of absurd symptoms. Pain, why my head has I have to have a headache? Why? Or why I cannot digest this or that? Why? So all these symptoms, as a rule, express the foolishness of our constitution. And they reveal the correct remedy. And when we give such a remedy, we can get a dramatic improvement of our constitution and also of our immune system. So I do believe that, of course, I think we have not to also not to listen too much to media and so on. We have to be flexible, not with a fixed frame in our mind, because life is to adapt to the instant. And so this is a part of healthy condition. And the more, if you are not able to do that, you are in a diseased state, and you are in a predisposition of disease.
Oh, thank you, Paolo. And was there anything else that anybody wanted to share, or shall I?
Yeah, that's absolutely fine. What Dr. Paolo said, like nature has its own state of molding and remolding itself, whether it's the artificial stage of disease or whether it's the natural disease. Nature itself has its own role to play. So when we accept that and try to follow our natural way of living and keep a stable state of mind and physical activities, then surely this disease will go off. So let's face it preparedly and accept it and stay healthy.
Let's be more compassionate. This is a virtue we all have to develop within us. for be it people who are suffering from it or people who have lost their near and dear ones, who are going through the post-traumatic stress disorder of losing their near and dear ones. Let's be compassionate and extend whatever help we can from wherever we are, in whatever small way. That is what we need to do in this moment.
Yes, true. That's one thing we can do in this stage. You know,
Right.
being compassionate, helping others, by whatever means it can be, you know, that will help our humanity to survive. It's a testing time for humanity.
That is what will heal the humanity. You know, we were so caught up in our small worlds, selfish worlds. So we have to just grow, expand, and open our hearts to whatever help, whatever love is possible. I think only love can heal in this times.
Thank you. Thank you. Well, thank you very much, everybody. This has been a remarkable talk, and it's incredible to hear in these two countries just the experience that you're having, and certainly it's sobering for an Australian, because we've just not had this experience that you're all talking about. And I absolutely echo what you're talking about, and that is that the way out of here is to wake up and, you know, to actually have some, you know, Paolo was talking about being present before, and that business of being present for another person is compassion, and it's empathy, and it's intuition. You know, it's the ability to actually be able to tune into the people around you in your community. And so that's what I would like to part with, is that the most healing that's possible is by when you actually become present, you know, from your heart, from your other minds. And in so doing, you are connected, and, you know, we become one in that sense. So I'm very grateful to you all. Thank you so much. And,
Thank you.
Go well, everybody. Yeah.
Bye.
Go well.
From India. Bye from India. Bye, Rajeshwari.
Bye from it. Bye. See you.